Brexpiprazole, brand name Rexulti, is an atypical antipsychotic drug that is used to treat a range of psychiatric conditions, including schizophrenia, major depressive disorder, and irritability associated with autism. It works by acting as a partial agonist at both serotonin and dopamine receptors in the brain. This unique mechanism of action is what sets Brexpiprazole apart from other antipsychotics on the market. Brexpiprazole is typically taken orally, and the starting dose for schizophrenia is usually 1 mg once per day, with the maximum dose being 4 mg once per day. For depression, the starting dose is 0.5 mg to 1 mg once per day with maximum of 3 mg once per day. It is important to note that the dose should be titrated slowly to minimize the risk of side effects. Some common side effects of Brexpiprazole include weight gain, drowsiness, headache, and increased risk of developing type 2 diabetes. It is also important to be aware of more serious side effects such as tardive dyskinesia, neuroleptic malignant syndrome, and elevated prolactin levels. The recommended laboratory test before starting Brexpiprazole include complete blood count, CBC, liver function tests, LFTs, kidney function tests, KFTs, fasting glucose, A1C, lipid profile, electrolyte levels, and thyroid function tests, TFTs. It is also recommended to monitor for changes in weight and blood pressure. It is also important to review the patient's medical history, including any pre-existing conditions and any current medications they are taking. There are certain contraindications for Brexpiprazole, including a history of sensitivity to the drug, and it should not be used in combination with certain medications. It is also not recommended for individuals with a history of seizure disorders or with a known allergy to Brexpiprazole or any of its components. It is important to have a thorough medical evaluation and discuss any potential drug interactions or health conditions before starting treatment with Brexpiprazole. There is a warning issued by the United States Food and Drug Administration, FDA, regarding the risk of mortality in elderly patients with dementia-related psychosis who are treated with antipsychotics. The warning states that these drugs have been associated with an increased risk of death in elderly patients with dementia-related psychosis compared to those who do not take the drugs. It is important for patients and healthcare providers to be aware of this warning and weigh the potential benefits and risks of treatment before starting or continuing therapy with Brexpiprazole.